In this video, we're going to review the current and future treatments for age-related macular degeneration, one of the leading causes of blindness. First of all, there are two different types of AMD, exudative or wet and atrophic or dry. Atrophic AMD is much more frequent and it represents up to 85% of the cases of the disease. It is caused by the accumulation of drusen and the inflammation triggered by this. Exudative AMD is less frequent and it is caused by the neovascularization of the macula, which leads to fluid exudation and can cause hemorrhages, which would result in acute blindness. These two types therefore have different etiopathogenesis, meaning that different approaches are needed when it comes to their treatment. For the atrophic variant of AMD, there are no treatments currently approved. The only approach that has gathered sufficient evidence in clinical trials is dietary intake of antioxidants. These include vitamin B and C, beta-carotene, cupric acid, and zinc oxide. This combination of supplements reduces the risk of advanced forms of dry AMD, but more effective treatments are needed to truly change the evolution of this form of AMD. Investigation for new treatments is still an active field of research, which is focusing on targeting various pathways, such as the following. In the visual cycle, vitamin A derivatives may form aggregates leading to lipofuscin. ALK-001 is a new drug which inhibits this aggregation. Preventing the accumulation of the protein beta-amyloid has been thought to prevent inflammatory induction. However, its efficacy has not been proved. The alteration of the choriocapillaries induces hypoxia and could be potentially responsible for the multiplication of drusens. Vasodilators such as trimetazidine have been proposed to counteract choriocapillaries atrophy. Oxidative stress plays a key role in this disease. Therefore, to counteract oxidative stress, molecules such as OT551 or risoticanib have been proposed, as well as molecules such as standospirone which act on neuroprotection. Mitochondrial enhancers such as LME-pretide have demonstrated potential efficacy and safety in early phase trials. However, only nutritional supplements have proved to be effective in slowing down progression of the disease. Regarding the inflammatory pathways, complement inhibitors such as sirolimus and the ones presented in the slide are being explored, with variable success rates so far. Gene therapy demonstrated promise in preclinical trials, and phase 1-2 trials are ongoing to evaluate safety and efficacy in humans. Finally, cell-based therapies showed positive effect in terms of improvement of visual acuity, but also raised some concerns about safety in early phase trials. The current standard treatment for exudative AMD is intravitreal injections of anti-VEGF, vascular endothelial growth factor. There are many different monoclonal antibodies approved and used in clinical practice, the most recently approved being faricimab. Faricimab has been approved by the FDA and EMA this last year, and it is a bispecific antibody that targets both VEGF-A and the angiopoietin type pathway. Phase 3 clinical trials have shown its capacity to maintain clinical response with more prolonged treatment regimens compared to aflibercept. Even though current treatments are quite effective, the high frequency of injections, the trauma associated with intraocular injections, the percentage of patients that don't respond, and the long-term adverse effects such as atrophy make this a suboptimal treatment. That is why further investigation is being made in order to find more effective treatments that require less frequency of injections, such as the recently approved faricimab. Therefore, research is focused on finding more durable treatments. Other anti-angiogenic drugs are being investigated, such as abicipar-pegol and conbercept, among others. Other forms of administration are also being studied, such as ranibizumab portal delivery system or PAN 90806, which is administered as a topical drug. Other fields of investigation include the inflammatory and immune components of the disease, as well as the endocrine pathways. Regarding anti-PDGFs, the antiplatelet-derived growth factor upregulates the response of anti-angiogenic therapy, promoting resistance to this therapy. Molecules such as peglotinib are currently in studies for a possible combined therapy to improve the anti-angiogenic effect. On the other hand, angiopoietin-2 is a cytokine that, in association with VEGF, has an effect in neovascularization. Angiopoietin-2 inhibitors, such as faricimab and nesvacumab, are being tested in combination with anti-angiogenic drugs to improve the clinical outcome of the treatment. Besides angiogenesis, several other targets have been explored, including PPAR and integrin receptors, and anti-immune or anti-inflammatory pathways such as mTOR, TNF-alpha, and complement cascade. However, most of these drugs did not go beyond phase 2 of clinical trials because of lack of efficacy or tolerance problems for healthy patients. Other curative strategies, including the use of stem cells, should give a perspective for vision recovery and may be a complete cure if used in combination with other treatments. Studies with human-induced pluripotent stem cells and human embryonic stem cells are currently ongoing. All in all, AMD is a real concern for public health. Its physiopathology is not fully understood yet, and no curative treatments have emerged. Currently, the only treatment for dry AMD is dietary intake of antioxidants. Future trends aim not only to delay disease progression and to prevent its evolution to exudative form of AMD, but also to stop progression and even cure the disease. Regarding exudative AMD, despite the success of anti-angiogenic agents, long-term side effects and the burden of frequent injections and visits impede treatment sustainability and outcomes. Newer agents aim to reduce the treatment frequency while maintaining or improving results. Many of the agents mentioned show promise, but their long-term efficacy and non-inferiority to current treatments need further validation.